Hi, my name is Livia Kupker, and this is my presentation on Alzheimer's. Alzheimer's is a neurological and neurodegenerative disease that affects 6.9 million people in the United States. This number is expected to double or nearly double by 2050. Dementia is a blanket term for patients with cognitive diseases that includes Alzheimer's. But 60 to 90% of dementia patients are those with Alzheimer's. Women are typically affected by Alzheimer's more than men. So 1 in 5 women, or nearly 2/3 of all people with Alzheimer's, are women, while 1 in 10 men are affected by Alzheimer's. Alzheimer's was the fifth leading cause of death for those 65 and older in 2021. Caregivers and healthcare workers have many worries and qualms with the care needed for each patient. Care for those with dementia was expected to reach $360 billion. 70% of caregivers struggle to coordinate care. 74% of caregivers worry and struggle with keeping their own health maintained while caring for someone with Alzheimer's. And 60% of caregivers believe that the U.S. healthcare system is not helping them accurately navigate care for their loved one. A diagnosis for Alzheimer's cannot be definite until that person has passed away and an autopsy has been performed. A probable diagnosis for a living person with Alzheimer's is a steady and constant loss of cognitive functions, genetic testing or record of family history with Alzheimer's, clear impairment of learning and memory. Physical tests that may be necessary for each patient include PET scans, MRIs, and CAT scans of the brain to look at structural or functional changes in the brain. Blood tests are also used to rule out other diseases, or in this case, vitamin deficiencies, thyroid issues, or other irregularities in the blood. Features of Alzheimer's includes memory loss, which is forgetfulness in the start of Alzheimer's that leads to complete loss of memory, typically both long-term and short-term memory. Cognitive decline, which is difficulty with decision-making, problem-solving, and reasoning. As the disease progresses, it becomes more and more difficult, mainly due to memory loss. Confusion is a very common attribute and feature of Alzheimer's due to memory loss, but recognizing faces, time frames, and places becomes very difficult. A feature of Alzheimer's that most people don't know about is the physical decline that actually occurs. Balance becomes an issue, which leads to the patient and caregiver to fear them falling. So their life becomes more sedentary. Therefore, the body weakens over time because they're not moving as much. Behavioral changes due to confusion and memory loss causes mood swings such as anger, depression, and paranoia at any given moment. Physiology of Alzheimer's has 3 main features. Amyloid plaques or brain plaques are misfolded extracellular tissue that leads to pressure on the neurons. That is shown in the bottom left corner. Neurofibrillary, or tangles in the brain, are buildup of misfolded proteins within the neuron, which you can see in the bottom middle picture. And loss between neurons does not allow for the synapse to make it to where it needs to go. Therefore, the thought cannot be completed. You can see that in the bottom right corner where the axon is broken apart. History of Alzheimer's starts mainly with Dr. Alois Alzheimer, who discovered changes in brain tissue of a woman who died of an abnormal illness that had not been studied before or not been studied much. Um, Her symptoms included memory loss, bipolar behaviors, and language issues. In 1901, Dr. Alzheimer performed an autopsy on this woman and discovered amyloid plaques and neurofibrillary tangles inside of her brain, which due to other autopsies, he knew this was abnormal and therefore something was different with her brain. He concluded that these abnormal structures were the cause of the disease and the cause of her symptoms, which was memory loss, bipolar behaviors, and language issues. Treatments of Alzheimer's includes medications, immune therapy, and other clinical trials, but currently there is no current cure for Alzheimer's. There are multiple treatments that are used to lessen symptoms or slow the development of the disease, but no magical fix or cure. Medications such as Dunpezil and rivastigmine and galantamine, I don't know if I said those right, are used to increase acetylcholine production, which helps with with memory and processing. Immunotherapy has recently been approved that targets amyloid plaques, which I will go show another picture. You can see the plaques in the bottom left corner, which can help ward off furthering of the buildup of the plaques, or possibly even lessen the plaques that are currently in the brain. Other clinical trials are currently in the works for better and more efficient treatments, but as of right now, this is where we are at. Alzheimer's prevention, um, much like the cure, there is no 100% prevention of Alzheimer's, but healthy eating, exercise, mental stimulation, heart health, and quality sleep over a lifetime is very beneficial for Alzheimer's prevention. Healthy eating helps us fuel our body to be able to heal and maintain the health that we currently have. Exercising increases blood flow to all body parts, including the brain, which can help ward off cognitive diseases. Mental stimulation can help build stronger synapses between neurons, which leads to less forgetfulness. Heart health is very similar to exercise. By increasing heart health, there is more blood flow and less chances of heart diseases, which can be known to cause cognitive diseases. And quality sleep is essential to recovery of the body. Lack of sleep has shown to increase brain changes associated with dementia. Life with Alzheimer's has 3 stages. The early stage, which is slight memory loss, difficulty finding words, trouble with organization, and misplacing items often. This is typically when the patient or loved ones of the patient notice that something is different, and eventually they go to the doctor and find a probable diagnosis. Middle stage includes difficulty performing tasks, loss of recognition of familiar faces, struggling to follow conversations, which in turn leads to mood changes, confusion, and frustration. Late stage typically requires full time care just for safety and for betterment of life. Full loss of recognition of loved ones, may lose ability to communicate, and tasks like eating and dressing may be impossible to complete on their own. Life with Alzheimer's, from a caregiver's point of view, has many difficult features associated with it, including emotional tolls, physical demands, social isolation, and small moments of joy. Watching a loved one lose their memories and personality is a hard toll to bear emotionally. Caregivers have been seen to struggle with stress, anxiety, and even depression at times. Caring for another adult full time, including dressing, feeding, moving, and more, is very difficult physically for a caregiver. Taking care of a person with Alzheimer's is a job 24/7 that extends from morning to noon to night and over again. Many caregivers feel isolated from family and friends due to the demands of caregiving. It's very important for caregivers to find small moments of joy. Um, Moments like a shared laugh or a memory are moments that a caregiver must hold on to in order to keep themselves happy and confident in what they're doing. All right. Thank you.